And we're live.
Good morning, everybody, and welcome to Journalists for Human Rights' first webinar event sponsored by CTV. I have to admit right at the outset, this is a first for me to do this, so bear with me if there's any technical issues, but we're really excited about this morning and the conversation we're going to have. There's about 200 people, I understand, out there watching, so you can send in questions. I am LaFlamme, first of all, and I'm so pleased to host today's event, as well as be an ambassador for Journalists for Human Rights. This is, as I say, the first of webinars JHR will be hosting throughout the summer. And the goal really is to examine the global response to COVID-19 and all of the human rights issues that are impacted by this crisis. Of course, under normal circumstances, we would love to all be in the same room together discussing this in person, but like every other organization in Canada and around the world, JHR is adapting. But as I say, this is an interactive platform, so you can participate by making comments or asking questions. And of course, there is that donation button. So if you feel inspired by the stories that you hear, please don't hesitate to push that button. We love your support. Now, let's begin with our first webinar. I'm going to give you a little bit of background on South Sudan, which is a complex country, as you probably already know. JHR has been working in South Sudan since 2013. It's implemented projects to strengthen media, and it's trained journalists, editors, news media managers on covering issues of human rights with an emphasis on the rights for women and girls. So, you know, all of this was moving along this project, and then boom, COVID-19 began its rapid spread across the globe and into South Sudan. So the team did an immediate pivot because, as you know, access to factual information can save lives, and that is never more true than in some of these countries like South Sudan. So today I am so thrilled that we will be talking to Siyabulela Mandela. He is JHR's team leader in South Sudan about that work. So Siyabulela, can I see you? Hello, there you are. Hi, Siyabulela, how are you?
Hello, Lisa, I'm doing great. I am still alive, and thank you for hosting me. How are you doing?
I'm great, and it's so wonderful to see you. Listen, there's so much we want to cover. I'm assuming the technology is all working. Somebody would be telling me if it wasn't, so this is great. And I want you to start, if you can, to give us the historical context on South Sudan itself. I think it's really important that people understand the situation there right now. And let's start with peace and order.
No, thank you, Lisa. South Sudan gained its independence in July 2011 as an outcome of the Comprehensive Agreement of 2005, which ended Africa's longest civil war. And South Sudan, immediately after that particular independence, it didn't even had a chance to enjoy the euphoria and jubilee that comes with the independence. It immediately relapsed into another violent civil war, which claimed thousands and tens of thousands of lives and displaced more than 4 million people in the country. And this is, Lisa, the country that is currently characterized by a vicious cycle of communal conflicts and with a lot of challenges. I'll cite a couple of few, such as the invasion of locusts, such as the widespread of malaria in the country, poverty, and the locust, which has further exacerbated the levels of poverty in South Sudan as they devour the agricultural produce in the country. This is a country that is currently characterized by a cacophony of challenges, as I have cited, and things are quite difficult at the moment, as things are and as I'm speaking to you, in different parts of South Sudan, in different states, the country is engulfed in a state of communal conflict, and the government is currently awaiting the finalization of the peace agreement, which was revitalized just a couple of months ago. So that is the kind of a country that we're talking about, with little or no infrastructure from all aspects that you can think of.
You know, when we think of South Sudan, you know, the youngest nation with the highest hopes placed on it at independence, and as you say, largely failed to deliver on so many issues. And then, boom, COVID-19 happens. So I want to give people some perspective when it comes to this latest crisis that is inflicting the country. So if South Sudan has a population of about 14 million people, that is the same as the province of Ontario, approximately. The latest numbers I was able to find, South Sudan has 30 deaths. Ontario, if we keep the analogy alive, is 2,500 deaths. Ontario has 2,000 ventilators. South Sudan has 4 ventilators. So first of all, give me some perspective on these numbers. Are they reliable? Is it accurate to even look at these numbers? Is there enough testing going on there? How has the COVID situation impacted daily life?
Well, I would begin, Lisa, by saying South Sudan followed suit with the approach used by many African countries. As early as March, it effected its lockdown and everything was at a standstill in the country. But unfortunately, the country couldn't continue with the lockdown, and as a result, the lockdown only lasted in South Sudan for a month.
So explain that, Siyabulela. Why couldn't the lockdown, and this was suspending flights, closing schools? Is it the density of population, or why did the lockdown not work?
Well, in South Sudan, the lockdown, more particularly the approaches and measures implemented globally, did not recognize the local and the material conditions in the ground. If you're speaking of South Sudan, it's a country that is as young as less than 10 years. And number two, the country infrastructurally, it doesn't have any proper infrastructure. People live below poverty line. And thirdly, insofar as the standard of living, the country doesn't even meet the minimum standard of living. So therefore, insofar as the lockdown measures in South Sudan, it was near impossible to even effect such, given the levels of poverty, given the fact that the country is not well developed, given the fact that the government doesn't have capacity and even the infrastructure to support its people if they are not going to work. So the government therefore decided to say, instead of locking people indoors and for people to die because of poverty, it's better off to just allow them to fend from themselves and to defend themselves from the violence. So that is the kind of a situation that we have at the moment. And so far as those numbers are concerned, given the health system of the country, in Juba alone, there are about only 3 hospitals servicing more than 3 million population in the capital city. And it's even worse outside, even here in Juba, the hospitals don't have capacity. They don't have healthcare workers, they don't have doctors, they don't have nurses. For a lot of trained physicians have left the country to seek greener pastures, given the levels of poverty and the salary scales in this particular city. So insofar as those numbers, that is not the true reflection of the numbers. And in fact, the high-level committee on COVID-19 in South Sudan stopped giving a daily update to the population because they do not even have the capacity for testing. When we began, we only had 4 ventilators servicing a population of about 4 million, as we've cited earlier on. So that is already a challenge. And in fact, as early as March, one of the contributing factors to government leaving the entire process of locking down the people is because everyone in the higher level committee, as led by the deputy vice president of the country, was infected by the coronavirus. So everyone lost hope and everyone was left to fend for themselves, and everyone now depended on humanitarian organization to assist them in this regard. So those numbers are not the true reflection of what is happening currently on the ground.
And humanitarian organizations like Journalists for Human Rights, this is a perfect opportunity to introduce the importance of journalism. If a government is not going to give daily numbers, if you've got 3 hospitals in a city of 3 million, how difficult was it for you to mobilize journalists to help get them the equipment they needed to safely do their job, to tell the public the truth about what is happening if the government was not willing to do that?
Well, JHR has been working in South Sudan for over 5 years. And as such, we have a large number of journalists that JHR works with in South Sudan. And we've trained journalists through different programs focused on training journalists on how to report on human rights related stories. And as such, we had already had a vast network of journalists on the ground. And secondly, because of our ideology and conviction that working with grassroots organization enables us to have a lasting impact, then we tapped into that world, and it enabled us to know how many journalists are in the ground in South Sudan and how much personal protection equipment we could mobilize as JHR through the support of our donors in order to make sure that we procure the PPE for the journalists and enable them to go in the field and protect them as they continue and advance journalism in the age of COVID-19. But it came with a lot of price, for in that process, we lost a lot of journalists who did not have faith first on the intervention given by government, and considering also the challenges that they are facing insofar as the suppression of freedom of speech in South Sudan. Some didn't see it as worth going into the field, having to deal with security apparatus that hinders their work, and also at the same time having to deal with coronavirus, which can emerge from any direction as they are engaged in the field. As a result, a lot of media organizations that we work with, be it Juba Monitor, Agamlong, The Dawn, the South Sudan Broadcasting Commission, they then requested personally, they sent emails to request the intervention of JHR. So that is how we came about an idea of providing the PPE to the journalists. And in fact, I personally was the one that was going on the ground with my team from station to station, media house to media house, making sure that our journalists are equipped, protected, and ready to face COVID-19 heads on as they inform our people.
So you were giving out masks? Is that what you were essentially handing out to journalists there in Juba?
Yes, we're giving out masks, we're giving out gloves, we're giving out sanitizers. And in fact, one of the most personal, which was a very painful story, when I visited the South Sudan Broadcasting Commission and had a meeting with the managing director, Ms. Suzanne, one of the things that she mentioned to me was that the hand sanitizer that was donated by JHR, she alone couldn't even afford it with the kind of a salary that she receives as the managing director of the National Broadcasting Commission in South Sudan. So those are kind of the challenges. And imagine then the smallest of media organization, what is it that they can be able to afford?
So this is so fascinating because, of course, we like to believe journalists are fearless in the face of any story, and especially in a country that has seen so much war. So put the fear in perspective, not just for journalists to cover it, But for the general population, do you have a sense that the people of South Sudan were even afraid of this virus? Or doesn't it measure up when you consider the other risks of daily life there and their history?
Well, given the history and the context that we alluded in earlier on, insofar as COVID-19 in South Sudan, the people were not as fearful of COVID-19, because one of the things that the people in South Sudan are afraid of is to die through the barrel of the gun. In South Sudan at the moment, there are more guns than there are citizens or the humans. If you have a population of 14 million people, there are more than 14 million guns that are circulating within South Sudan. As a matter of fact, the United Nations Security Council, just about a couple of days ago, reinstated the arms embargo against the government of South Sudan. And the response of the South Sudanese government was the fact that, in fact, the arms embargo alone is going to threaten the security of the country, for the citizens are more armed than the government, given the years of civil war that they've been engaged in. They are more armed, hence the continuous and the vicious cycle of violent communal conflicts in different parts of the state. That is what the people are afraid of. And in fact, on a daily basis, more than 100 people die in South Sudan as a result of communal conflicts. And these conflicts are as a result of one of the things that are provoking these conflicts. In South Sudan, the conflict is driven by cattle warfare. And the reason why it's driven by cattle warfare is that there are more cattle as well than there are human beings in South Sudan. And therefore, the conflicts that you see within communities are as a result of wars, fight over these cattle. And cattle in South Sudan means wealth. That's what it is. Leave alone the oil, leave alone the petroleum that the country is equally rich in. But the cattle are one of the driving forces of the conflict. So if you're talking about COVID-19, COVID-19 means nothing in South Sudan as compared to the fear that they have of dying through the barrel of the gun, and also because of the trauma that the South Sudanese people have acquired through over 20 years of a civil war within Sudan, when they were part and parcel of Sudan, and also the post-2011 5-year period again that they had another civil war.
So this is just complicating and already complicated the human rights issues like food, job security, access to medical treatment, but it is also sadly the perfect mix to promote, generate misinformation coming at the public. So give me some understanding on what kind of misinformation has been fed to the public to try to alter the truth of this crisis, the COVID crisis.
Well, I'll begin by saying, Lisa, South Sudan is a highly heterogeneous society with more than 200 ethnic groups and more than 200 languages. So at first, that's another challenge. How do you communicate with people in the language that they best understand? That was one of the challenges faced by journalists. And the second issue, South Sudanese generally are more leaning towards the traditional ways of doing things. They're traditional people, like most countries in the African continent. So there were a lot of kind of misinformation that got out there that, in fact, there are more herbal ways in which we can deal with South Sudan. This is by no means trying to attack the traditional ways of healing, but that was one of the challenges. And the second issue,
like what, for example, there was the story of that tea would cure COVID, or also, I mean, and I've got to say at the outset, this kind of misinformation has been happening all over the world, even out of the United States. We've heard a president who suggested that injecting some kind of disinfectant might cure COVID. So I just want everyone to have perspective. This is not unique to South Sudan.
Well, I fully agree with you. In fact, the South Sudanese are influenced by the Arabic culture of drinking tea. So generally, the average temperature in South Sudan is over 40 degrees on any given day. But the South Sudanese, you'll find them lining in the street and waiting for their tea the whole day. And a majority of people, there were misinformation that tea with lemon can help to mitigate the situation of COVID-19. And there were other kind of misinformation, for instance, because the first cases were registered within the United Nations compound here in Juba, there were misconceptions spreading around that, in fact, this is the disease brought by white people in the country, and therefore white people should be attacked. And if you are a white person, you are walking in Juba in the early stages of COVID-19, they will shout Corona. And to an extent, people would even run away from you because that was the kind of information that was generated and even driven by some media organization, which we later at JHR, because they are our partners, reprimanded them and advised them accordingly on how to deal with the situation.
Right, that became so dangerous. You're right. I think the first 4 cases in South Sudan were UN workers before actual South Sudanese cases started to emerge, and they were calling it the foreign disease. Again, that is fascinating, though, there was an immediate backlash on anyone who may have worked for the UN or any kind of Western organization as a result of that. But I want you to explore a little bit more on the street as you explain it the traditional way. And I'm thinking of these heaving, thriving markets in Juba, where it's largely women who are the sellers, women who are preoccupied and struggling to put food on the table. So give me some understanding on the further challenges under COVID for the women and girls who are trying to do what they always did do to try to help their families.
Well, let me begin by making this submission that I do not consider myself, first and foremost, Lisa, to be qualified to respond on this question, especially as it relates to women and girls, insofar as gender-based violence and some of the challenges that affect women. I do not qualify for the simple reason that, first and foremost, I am a man raised in a patriarchal society. Therefore, I have a tendency of being complacent on issues that affect women and girls. But I'm going to say this one thing. Since the beginning of lockdown in South Sudan and across the African continent, what we have observed is the rise on gender-based violence. And the challenges that we've been facing is that women are at the forefront of being exposed to the virus, given, insofar as South Sudan is concerned, given the fact that they've gone through various stages of civil war. Majority of families are women-led because their husband or their brothers died or perished during the years of civil wars in South Sudan. So you find the majority of women are the ones that are leading in the family. And in fact, if you go to the market, an open market in Konya, what you're going to see is the majority of stalls are led by women selling fruit, selling kitenges, selling all different products in an attempt to mobilize the resources that would enable them to be able to support their families. So those are some of the challenges. And in fact, we've even in our previous work as JHR, we've even exposed some of these challenges and amplified the voice of women of some of the challenges that the women are facing. Some are talking about the fact that they are losing customers and they're at the brink of being locked in a state of poverty because they are unable to support their families. And in fact, I think that's why even the government opted to leave the lockdown and open the country and enable everyone to operate as business as usual, given the challenges of COVID-19.
Because it's a challenge between being able to put if there's no government aid for people, they still need to feed their families. And I know we don't have a lot of time left, and And you've just brought up your own history, so I want to ask you a personal question, if I can. I mean, your great-grandfather, Nelson Mandela, a symbol of empowerment in the face of adversity. And I just wonder, I mean, we are certainly globally now facing great adversity on so many levels, not just COVID, but also racial injustice around the world. And I wonder if his legacy has informed the work that you do now for journalists for human rights and a free press.
Well, I would say, in fact, Nelson says elsewhere that after climbing a great mountain, you realize that there are many more mountains to climb. So this alone is another mountain. And he also, I'm always reminded that when Nelson said, it seems impossible until it is done. Even this mountain, as the entire world, we are going to conquer. And these words, and this is his legacy entirely, is the kind of legacy that I have dedicated myself to continue in different parts. In fact, that's one of the reasons why I joined JHR. For Nelson Mandela, throughout his life, he was an advocate for the Declaration of Universal Human Rights for everyone to be able to be treated equally in the world. And the kind of the work that journalists for human rights is the kind of work that attracted me. And I saw it as a way in which I can continue that legacy.
And you know, it is such a critically important one. And we're getting some questions, and I know we don't have a lot of time, but one really great question here based on what you're saying is how can journalists in a conflict zone like South Sudan prioritize coverage, both reporting on war and on the pandemic?
Well, I think one of the most critical things that any media organization need to do is the kind of approach that journalists for human rights followed. Journalists for human rights, together with a number of international media organizations, decided to consolidate their efforts and mobilize their resources under the auspices of the campaign Information Saves Lives. So consolidation of resources, coordination is one way in which media organization can be able to both combat COVID-19 while dealing with violent conflict.
And you know, it's interesting because certainly in this country, media organizations are suffering under huge financial losses as a result, not just of COVID and no advertising, but it's been a general trend over years. And I wonder how that situation unfolds there. How does a journalist even get paid in Juba? I think there's about 100 journalists there. What's the situation?
Well, the challenges with South Sudan, insofar as media is concerned, majority of media organizations, if not all, depend on foreign investment. They depend on donors. So if you look at all the media organizations, even all the partners that JHR has, JHR is at the forefront and is standing in the gap, mobilizing funds and resources to enable these media organizations on the ground to continue their work. That is why JHR, therefore, is of critical importance to the development of South Sudan as we support both the peace process and the development of the country. And that is how we continue supporting the media organizations on the ground by standing in the gap, even during these difficult times, mobilizing resources, making sure that the work of journalists in South Sudan continues, making sure that we mobilize the resources to procure the PPE for journalists so that they are protected as they go into the ground. That is one way in which journalists are surviving. They survive on humanitarian aid, they survive on the sponsors mobilized by organizations at JHR. That is where our importance comes into play.
It's so critically important. And I wonder, just as we wrap up, Siyabulela, if you have any sort of final thoughts, message to the world as the world struggles with this crisis, but the world is not dealing with the same level of complexity and conflict that you are living in right now, and your fellow journalists and the people of South Sudan.
Well, one thing I would say first and foremost to the people in Africa, I would like to say you are not alone. In this fight, we are together, and together we would emerge victoriously. And I understand that Africa, and that is one thing that the rest of the world need to understand, that we are not operating in the same level. There's so much challenges that the African continent is battling with. Just in the DRC, they are battling with an outbreak of Ebola. Just in South Sudan, they are battling with the invasion of locusts that devours the agricultural produce. They are engaging with mental health. South Sudan is one of the leading countries on mental health in the continent. They are dealing with communal violence. So those are some of the things that the rest of the world need to recognize, and insofar as mobilizing resources and make sure you bolster any efforts that any country in the African continent is advancing, we need the help of the rest of the world. And it is only when we come together that we are going to be able to emerge victoriously as the world against COVID-19.
And we all pray for that. And we thank you so much. This has been so enlightening. Siyabulela Mandela, thank you for sharing with us the incredible work that you do on the ground there, and your whole team from Journalists for Human Rights. So, and I also want to thank all of you, all of the people out there who we can't see, but hope that you have found this enlightening also. And thank you for joining us as we look beyond our own borders to see what the situation is around the world. These conflicts do not happen in a bubble. So we need to expand our bubble, if you will, if not physically, then certainly mentally and emotionally, to know that this COVID crisis is just one of so many in so many parts of the world. So thank you, everybody, for joining us on this first Human Rights webinar for JHR. Signing off, Siyabulela. Talk to you soon.
Thank you, Lisa.
When the flights open again, I'm coming to Juba.
You are more than welcome.
Okay, bye everyone.